Well, it's always a pleasure to have Dr. Lisa Curcio on from BreastLink. And this time around, we're talking about a subject that, well, is not often talked about. Doctor, welcome.
Thank you.
Great to see you again.
It's always a pleasure.
And today we're talking about male breast cancer. And although this is rare, it does occur, but it's very rarely talked about, and I'm sure most men don't even think about it, right?
Right, and I think this is a great time to really recognize the fact that men are affected by breast cancer too. Male breast cancer is only about 1% of breast cancer diagnosis that we see in the office. So for instance, for every 100 women, we see maybe one male with breast cancer. But it is an important diagnosis because commonly the patient has symptoms that don't get easily diagnosed or recognized as being breast cancer.
So what would be some of those symptoms? I mean, after all, men don't go in and get mammograms that
Correct.
I know of.
Correct. We're not usually screening men with mammograms, so it's really physical examination. And it's important for men to just appreciate if there is a change with their breast tissue. So a lump, a thickening, a skin change, a nipple change, or a discharge from the nipple can be early signs of breast cancer in a man.
Okay. Is breast cancer in men caused by the same thing that happens to women? Because I've heard a lot, you know, with women, there's obviously the different points in their life where their body changes more than men does, estrogen levels, all kinds of different things. So what causes it in men?
Well, it is a hormonal disease in men also, and it sometimes has to do with the imbalance of estrogen and testosterone. Surprisingly, men do make estrogen, but usually it's in a low level and testosterone is much more dominant. So one of the risk factors is men that are being treated hormonally for prostate cancer, their estrogen levels are allowed to rise, and that could predispose them to a breast cancer diagnosis.
Okay, what about breast cancer history in the family? And I'm not talking about, because again, they're probably not looking back in their history when it comes to men, but maybe their mom had it and their grandmother or sister.
Particularly hereditary breast cancer, so when you see multiple relatives. We do know that women who have the BRCA mutation, particularly BRCA2, there's a higher risk of male breast cancers. So it is important for everyone to know what their family history is, and if there is multiple relatives with breast cancer in the family, someone should be tested to see if perhaps the men are at risk.
So that would be genetic testing that you would do? Okay.
Yes.
All right, if a man is diagnosed, is the treatment the same?
Yes, very much so.
Okay.
Yes, it's treated with removal of the tumor or the entire breast tissue, biopsying the lymph nodes, and then depending on the stage, chemotherapy and or a pill, which is called endocrine therapy.
Okay, what about age? We often hear with women, you start screening, I think, at 40 on a more regular basis.
Yes.
And so I'm assuming that it's more common for older, middle-aged women to get breast cancer versus young, although it does happen.
Correct.
What about with men?
Well, with men, it seems like the incidence of male breast cancer is a little bit later, in the late 50s, early 60s.
Okay.
But I think it's a good habit, particularly if there's a family history, for men to be examining their breasts regularly, since they are not being screened with things like mammograms.
Okay. This is you know, kind of like the way years ago, I'm not saying now, but years ago when it came to colon cancer, a lot of women didn't get screened. They get screened a little bit more, I think, now, where years ago it was considered just a male disease, which of course was not true.
Right. Yes, well, once again, the statistics are breast cancer is obviously much more common in women than in men, but I don't think we'll be starting screening on men anytime soon. But I think there should be a heightened awareness by physicians, primary care doctors, that new breast symptoms should be evaluated and start off with something like an ultrasound, and we even do mammograms on men where we're concerned.
Oh, okay. What about lowering your risk just in general? For both, obviously for women, you've talked about that many times, same thing for men, just diet, healthy living, that sort of thing?
Absolutely. I think number one is recognizing if you're at increased risk, and if you have a strong family history, you could come in for a risk assessment, and we could even do some genetic testing. And if you have a BRCA mutation, we might want to do screening mammograms, and then lifestyle modifications, staying at a healthy BMI or body weight, exercising regularly, and eating a healthy, predominantly plant-based diet.
And of course, I know you've talked about this before, is if you still smoke, smoking seems to cause everything.
Correct.
It's a risk factor for just about everything, am I right?
Correct, and we
Yeah.
are recognizing more and more that alcohol is a risk factor for breast cancer too.
Oh, okay, because there's another one of those things you hear, well, if you drink red wine or you do this or that, it goes back and forth, but you're looking at that as well?
Yeah, so there is a lot about the medicinal value, particularly for cardiac disease with red wine, but the data seems to hold pretty strongly that if you drink every day, one drink a day increases a woman's breast cancer risk by 10%, and if you have 3 drinks a day, it's up to 30% increased risk. Wow,
all right, very good. Well, if you'd like to find out more about this, or for some reason you would like to get in contact with BreastLink, maybe it's time, if you're a woman, to set up your mammogram appointment, or if you're a man, you have some concerns, give them a call and they can certainly go through the steps with you. Interesting topic, and not something that's really talked about much, but I'm glad you did. Thank you very much.
Thank you for having me.
Doctor, always good to see you.
Thank you.
Take care. We'll be right back.